Hi, I am Dr. Sulata Shenoy, Director, Turning Point, Center for Psychological Assessments, Therapies and Counseling. Schizophrenia is one of the common mental disorders and it is a serious psychotic condition which is mostly chronic and takes a toll not only on the individual but also the family members who are the primary caretakers. Earlier, mentally ill patients and schizophrenics would be immediately institutionalized and taken away from their homes and put in centers or institutions almost for their entire lives with very little contact with the outside world. However, the thinking has changed and it is now seen that schizophrenics can be handled at home with proper treatment and guidelines given to the caretakers. No doubt it is very stressful and difficult having a schizophrenic patient at home because of the bizarreness of the behaviors that the person may exhibit. So sometimes it is important for caretakers and family members to know how they can help the person and in addition help themselves, because unless one is emotionally and physically strong enough, one cannot help the weaker person. So how does one do that? First, have compassion towards the mentally ill patient. He or she didn't ask for that affliction on himself, and it is a combination of, now we know, of neurological, biological, genetic and social, psychological factors that have brought this affliction on this disorder on the person. So have compassion. Second is educate yourself about the illness. A lot of misconceptions are there that the person may become extremely violent, the person may pose a threat to other family members and is a poor role model for other family members and children and adolescents in the house, which may be true, but then one also needs to accept them as family members and see that all these misbehaviors or dysfunctional behaviors can be contained very well with the present generation of medication, treatment and psychotherapy. So there is no reason to fear having a mentally ill patient at home, just as one would look after the aged, the sick, the children and all vulnerable sections of family members without discarding them or having them out of the house. One should look on mentally ill patients with the same compassion and the same amount of cheerfulness. After educating yourself about the illness, you would do well to look at all the various resources, because the patient is not the person who would seek the professional help. It is you who have to see where is the best professional help that you can afford. Where are the respite care centers? What are the networks that online, offline, physically in your neighborhood, in your community, among your family and your friends whom you could seek? Because remember, you have to look at this as a stressful situation and you need methods to cope. One needs to have realistic expectations about the schizophrenic's course of illness, because it could wax and wane at an hourly basis, daily basis or monthly basis. And lastly, don't forget to be part of the treatment team. Talk to the doctor, talk to the psychologist, talk to the social worker, talk to the psychiatrist to find out what you could do when the medications need to be taken, if medications need to be monitored, what are the other lifestyle changes that this person needs, whether it is in exercise, in diet, in family support, etc. So with that, you will have a good acceptance and understanding as well as leading to a healthy and harmonious family at home.